What is the best massage technique to look younger instantly? When someone asks me this, I always say the same thing. Facial sagging after 60 isn't just from aging, it's from stagnant circulation and unused muscles. And if you don't wake those muscles up, no cream or serum will firm your skin, no matter how expensive. So in this episode, Japan's oldest doctor will walk you through a simple at-home facial massage, using just your hands that can help lift the cheeks, tighten the jawline, and smooth the forehead in under 10 minutes, the most effective way to make yourself look younger. Welcome back to the Senior Health Podcast. Today you'll hear step-by-step how to perform this 9-part massage ritual, rooted in Japanese facial therapy and backed by modern lymphatic research to help your skin feel fresher, brighter, and more alive. He's over 100 years old, still treating patients, and considered a national treasure in Japanese medicine. Doctor, welcome. I know people have been waiting for this one.
Yes, John. This one is close to my heart because I've watched too many patients over the years feel like their faces no longer reflect their spirit. But the face is not a photograph, it's a living system, and it can be reawakened. So I am sure everyone will love this episode.
That already changes so much, because we're taught to think of facial aging as inevitable, something to hide or cover, instead of something we can support and restore.
Exactly. The face holds more than expression. It holds lymph fluid, tension, old habits and emotions. And after 60, if we don't help it release those things, the signs show up as sagging, puffiness, and loss of tone. But these signs aren't permanent. They're requests for movement.
In past episodes, we've explored how inflammation, diet, and muscle loss can show up in the skin. And today we're taking that deeper. We're going to use massage to stimulate blood flow, activate collagen pathways, and help drain the fluids that cause puffiness, all using movements anyone can do from home.
And for those who follow through and actually complete the sequence for 14 days, you may not just see a difference. You may feel it in your mood, your posture, even your confidence.
That's my favorite part, because most people think self-care has to be expensive or complicated. But what you're showing here is that the face, like the rest of the body, responds to presence, rhythm, and care.
It always has. And in the next few minutes, we'll begin with the areas most people ignore. The lower jaw, the neck, and the cheeks. These are the foundations, and once they move freely, everything else begins to lift.
I'll be honest, I started doing this massage 2 weeks ago just to prepare for the show. And the first few days I didn't notice much. But then one morning I looked in the mirror and thought I look more like myself. And that surprised me, because I wasn't trying to look younger. I was just trying to look less tired.
And that's the real result. Not youth, not perfection, but a return to the version of yourself that feels awake, inside and out.
So before we begin, we want to know you are here as a listener. Comment where you are watching from. We love to hear. Now let's dive into it, Doctor. What is the very first area of the face that we should always start with, and why does it make such a difference?
The first area we always begin with is the jawline. And not for aesthetic reasons. It's because this is where lymph stagnates first. The jaw and lower cheeks collect tension, fluid, and waste that the body hasn't cleared overnight.
That's something I've never thought about, that aging can begin with what the body fails to drain.
Yes, and the longer that fluid sits, the more the skin stretches to accommodate it. Over time, that pull becomes sagging.
So it's not just gravity, it's stagnation.
Exactly. Gravity is a factor, yes, but the body has systems to resist it. Lymph flow, circulation, muscle tone, and when those slow down, the skin loses its internal support.
That really changes how we think about aging, not as collapse, but as a quiet surrender of circulation.
And that surrender can be reversed. In Japan, we often say the face is the surface of the breath, and the breath moves where tension is released.
That's such a poetic way to frame this, because in the West we see the face as a canvas, something to be filled, covered, or fixed, But you're saying it's not a canvas. It's a map that shows where we've been holding stress, fluid, even emotion, and that with the right touch, that map can change. So with that in mind, let's move into the first of the 9 massage techniques, beginning with the jaw and neck. And I suggest you as a listener to stay with us, because you will need all 9 for the best results. Now, doctor, where exactly do we place our hands, and what should we be feeling when we do it right?
Begin by placing your fingers just beneath the curve of your jaw, with your thumbs resting lightly under the chin. Glide your fingers upward along the edge of the jawbone until you reach the space just below your ears. This movement is not random. It follows the natural path of lymphatic flow. Once you reach that point near the ears, sweep gently but firmly down the neck, ending at the collarbones. You are encouraging the body to drain old fluid, not forcefully, but rhythmically.
When I did this for the first time, I noticed my face felt warmer within a minute. It wasn't just heat, it felt like circulation had been reawakened, like something dormant was moving again. And I realized I'd never actually touched my face that way, not with that kind of presence.
That warmth is your capillaries opening. It's a sign that the tissue is receiving oxygen again, not from outside, but from within. Most people only massage the surface of the face. But when you follow this pattern, upward under the jaw, down the neck, you're accessing a deeper system. The lymph nodes below the ears are key drainage points. If they're blocked, even the best creams can't help. So we start here because this is the foundation. The first path the body uses to release swelling and restore tone.
So it's not about pulling the skin tighter. It's about clearing what shouldn't be there in the first place.
Exactly. You're not sculpting, you're releasing.
That really reframes the whole idea of lifting. It's not artificial. It's about helping the face do what it already knows how to do, if we support it. So once this system is open, once the jaw and neck have been activated, what's the next layer we should focus on?
Now we shift to the second technique, which belongs to the underside of the chin, where sagging and double chins begin to form. You begin by clasping the jaw with both hands, fingers wrapped firmly around the bone from each side. The grip must be strong enough that you can feel the jawline through the skin, but not so hard that it causes pain. From there, you glide your hands upward along the bone, then gently release and repeat. Do this 7 to 10 times, slowly, each pass sending a message of structure and renewal.
That's something no one tells you, that the double chin isn't just from fat or age, but from muscles that have gone quiet. It's like we forgot there were even muscles there. But this movement, it feels like you're waking them back up.
Exactly. When the jawline begins to sag, it's often because the underlying tissue has lost connection to tension, not damage, just disuse. And by pressing into the bone, we remind the nervous system that this area is still alive. The fascia, the skin, the lymph, the muscle, they all respond to engagement. You're not just lifting, you're re-establishing boundaries that the body can then maintain.
So this isn't surface work, it's re-education for the face.
Yes, it's a reintroduction to firmness from the inside out.
And what stands out to me is that the movement is repetitive, but not mindless. Each repetition builds a kind of memory into the tissue. So once we've brought this level of tone and attention to the jaw, what area do we move to next, and what changes when we get there?
Now we come to the third technique, one that activates the ears, stimulates circulation, and clears the lymphatic system like opening a drain. Place your fingers just in front of your ears, where the jaw connects to the skull, and begin making small circular motions. You want to press deeply enough that you feel movement under the skin, but gently enough that it doesn't cause discomfort. From there, glide your fingers upward slightly, Then sweep them backward and down along the line just behind the ear, tracing the pathway of the lymph. Do this until your ears begin to feel warm. That's the signal your system is responding.
That's such a subtle cue, warmth in the ears, but it's also a clear sign that something is shifting, that the fluid isn't stuck anymore. And what surprised me most is how calming it feels, like the pressure in my whole face drops a little.
That sensation is not just emotional, it's physiological. There are major lymph nodes behind the ears, and when they're stimulated, drainage improves, not just in the face, but also the scalp and sinuses. Blood vessels dilate, fresh oxygen enters the skin. The temperature shift tells you the system is opening and that puffiness will begin to recede. Many people feel their whole head lighten after this technique, because stagnation doesn't just weigh down the skin, it dulls the mind.
So in some ways this massage isn't just cosmetic, it's also cognitive?
Yes, in Japan we say a bright face begins with clear channels.
I believe that, because after doing this part of the massage, I didn't just look less puffy, I felt more focused, more alert. So now that we've opened the drainage behind the ears, where should our hands go next? And what structure are we lifting in the face itself?
Now we begin the fourth technique, lifting the corners of the mouth and reawakening the cheek muscles, which are some of the first to lose tone after 60. You place your index and middle fingers beside the corners of your mouth, gently hooking into the natural crease there. Then, in one smooth motion, glide your fingers upward along the cheekbones, toward the temples, as if you are drawing a smile into the muscle itself. Pause briefly at the top, then release and repeat. This upward arc, when done slowly and with slight pressure, helps strengthen the zygomatic muscles and train the face to lift itself again.
That image of drawing a smile into the muscle really stays with me, because it makes this feel less like a workout and more like emotional alignment, like you're reintroducing the face to joy, to movement, to youthfulness that comes from within.
Yes, because expression shapes structure. Over time, if we carry sadness or tension, the muscles around the mouth collapse. They fall inward, but when we retrain the cheek muscles with touch, we invite a new shape, one based on openness. This also reduces the sagging effect that pulls the jaw downward. With the daily repetition, many people notice their entire lower face becomes lighter, not just in how it looks, but how it feels.
So this isn't just about lifting, it's about unburdening.
Correct. You are lifting away the weight of unused emotion and unspoken stress.
And I love that this technique also addresses the emotional toll of aging, because many people feel like their face has lost its character. But what I hear in your words is that character can be restored. So now that we've lifted the cheeks and mouth, what part of the face should we bring attention to next, and what hidden tension are we about to uncover?
Now we move into the fifth technique, which addresses one of the most stubborn signs of facial aging, the nasolabial folds. You begin by placing your fingertips on either side of the nose, just where the folds begin to form. Then, using gentle outward pressure, you stretch the skin diagonally, not only to flatten the crease, but to release the tension buried at its base. Hold for a moment, then trace the movement upward toward the top of the cheek, like smoothing out a wrinkle in fabric. This stretch calms the levator and buccinator muscles, which are often tight from years of unconscious holding, especially from frowning, chewing, and even smiling under stress.
That's something people rarely talk about, that smiles, when held under stress, can leave just as much tension as frowns. And this area, the base of the nose, the cheek crease, it seems to absorb that history. When I did this stretch slowly, I felt a surprising amount of sensation, almost like the muscle didn't know how to let go.
That's very common. These folds are not just from age, they are the signature of repetition, and over time, That repetition becomes etched into the face. But what we're doing here is different. We're not trying to erase the fold. We're asking the muscle underneath it to soften, to release its grip. And when that happens, the line becomes less fixed. It loses its weight. The face appears more open, more balanced, and most importantly, more comfortable.
So the real goal here is not perfection, it's relief.
Exactly. This is restoration, not correction.
That distinction really matters, especially for older adults who've been told their face needs fixing. What you're offering is the opposite. It's a way to reclaim natural structure. So now that we've released the center of the face, what comes next?
Next is technique number 6. Focused on the eyes, where fatigue, age, and emotion tend to leave their most delicate mark. Begin by gently placing your knuckles or fingertips along the outer edge of the eye socket near the temples. Then, with light circular motions, trace the bone gently under the eyes, inward toward the nose, and back around in a full arc above the brow. You're not rubbing the skin, you're massaging the muscle beneath it, especially the orbicularis oculi, which encircles the eye like a soft ring. As this muscle relaxes, the eyelids begin to lift naturally, and the wrinkles at the outer corners soften, not because they are erased, but because the tension that deepened them is gone.
When I tried this one, I noticed two things almost immediately. First, how sensitive the area is. It felt tender, even a little emotional. And second, how deeply relaxing it was, like I hadn't realized how tightly I was squinting or furrowing until it was gone.
That tenderness is the body's way of telling you, thank you. The eye muscles are often overworked. From screens, from squinting, from years of emotional expression, and unlike other parts of the body, these muscles don't get stretched or moved in daily life. That's why this massage is so powerful. It helps reduce eye bags, yes, but more importantly, it improves microcirculation, so nutrients and oxygen can reach the area again. This isn't just about looking more awake. It's about supporting the delicate tissues that help us see, focus, and connect.
So it's a functional lift, not just a cosmetic one.
Exactly. You're not pushing up skin. You're clearing away what's been weighing it down.
It's incredible how such a small, gentle motion can have such a visible and internal effect. And it makes me wonder, if we hold that much tension in the eye, I can imagine we are also holding it just above that in the space between the brows, right?
Yes, this is the 7th technique, focused on the space between the eyebrows, where frown lines often settle like a shadow of worry. Take your index and middle fingers and press gently into the inner brow, right above the bridge of the nose. Hold for a few seconds, then move outward in slow, horizontal strokes along the brow line, as if smoothing the tension away. You'll notice the skin here may feel tighter, more resistant. That's because the corrugator supercilii muscle, which pulls the brows together, has likely been overused. Stress, light sensitivity, and habitual concentration all create tension here that doesn't release on its own. But with repetition, this massage helps soften the deep furrows and restore ease to the upper face.
That's the line so many people call the 11s, those twin vertical creases that make us look angry or stressed even when we're calm. And for years, the only option people were offered was injections. But here, you're showing there's a way to help that muscle soften itself from the inside.
Exactly. Botox freezes this muscle, but massage teaches it to let go. That's a very different relationship. You are asking the body to participate in its own healing, and over time, that creates changes that are not only visible, they are sustainable. You'll notice more space in your expression, more lightness in the eyes, and often people say they feel less reactive simply because this tension is no longer pressing inward all day.
So this isn't just face work, it's nervous system work.
Yes, and it's often the most transformative for those who carry invisible stress.
That's a powerful reminder, because the face doesn't just show age, it shows habit, defense, fatigue. And when we meet those things with touch instead of force, something deeper begins to change. So once we've softened the center of the face, what about the top, where lines tend to stay even when the rest of the face lets go?
Now we move to the 8th technique, lifting the forehead and releasing the adhesions between the skin and skull. Begin by placing your fingertips just above the eyebrows, then press gently upward toward the hairline. Hold for a few seconds, then use a gentle, rocking motion to shift the skin from side to side, as if checking how freely it moves. Most people find that this area is surprisingly stiff. That's because, over time, the fascia here becomes stuck to the underlying bone, creating horizontal lines and restricting the blood flow. By freeing that connection, we restore mobility, and mobility leads to softness, flexibility, and a forehead that lifts naturally.
That's something I never considered, that the skin on the forehead could actually get stuck. I always thought wrinkles here were just from repeated expressions, but you're showing that it's also about adhesion, about the skin losing its glide.
Exactly. The skin should move like silk over the bone, not stick like tape. When it becomes fixed, even neutral expressions look strained. But once you release these adhesions, the skin breathes again. Blood flow returns. The surface begins to reflect the freedom beneath it, and that alone can change how someone looks and feels in a matter of days.
So this massage helps restore not just tone but texture.
Yes, it softens both the look and the feel of the forehead.
It's amazing how something as subtle as rocking the skin can signal so much to the body that it's safe to soften, safe to move. And once we've lifted this area, there's really only one place left to go, the very top. What happens when we bring this practice to the scalp itself?
Correct, John. Let's look at the 9th and final technique, massaging the scalp and hairline where hidden fluid and tension often remain trapped. Begin by placing your knuckles at the center of your forehead, just above the brow line. Slowly drag them backward into the hairline, applying enough pressure to move the skin without causing discomfort. From there, use circular motions across the scalp, especially along the top and sides, to gently release tightness and improve circulation. These movements stimulate lymphatic drainage in the entire upper face and also help prevent swelling that often settles overnight in the eyes and forehead.
I'll admit, when I first tried this part, I thought it seemed unnecessary, but within seconds I felt a release I didn't expect, not just in my head, but all the way down my face.
That's because the scalp is part of the same system. If the top remains tense, fluid has nowhere to go. It becomes trapped, pooling in the forehead, around the eyes, even in the cheeks. But when we mobilize the scalp, we clear a path for everything below to shift and reset. Many people report that this technique alone helps them sleep better, feel calmer, and experience less facial tension in the morning. And when done regularly, it improves not only the contours of the face, but the brightness of the skin.
So the hairline is more than just the border of the face, it's the final release point?
Yes, it's the ceiling of the system, and when it softens, the entire face has permission to rise.
That's a beautiful image and a powerful way to end the sequence. Because what started as a facial massage has turned into something deeper, a method for reminding the body that it still knows how to heal. So for someone listening who's never tried this before, what would happen if they did all 9 of these just once and then stayed with it for 2 weeks?
If someone committed to this practice for just 2 weeks, they would likely begin to see not only visual changes, but sensory ones. The skin may feel warmer, more elastic, more connected to the muscles beneath. Puffiness would begin to reduce, not because of force, but because of restored flow. Expressions may soften, not because lines disappear, but because the body isn't holding as tightly. And for many, this leads to a quiet kind of confidence, the kind that doesn't come from looking younger, but from feeling more alive in one's own skin.
That's such a powerful distinction, because for so many people after 60, self-care starts to feel like a losing battle, a chore. But what you're offering here is something completely different. It's not about chasing youth, it's about remembering vitality.
Exactly. These movements don't erase your years. They honor them. They help you meet the face you have and offer it care instead of critique. And when that happens, something shifts. The mirror becomes a place of relationship again, not rejection. And that change, even if small, ripples into posture, presence, even how you speak. You walk through the world with a little more dignity, because your body feels tended to, not ignored.
And that's something no cream or surgery can give, that feeling of inner coherence.
Yes, the touch says, I'm still here. I still matter.
That's the note I want to end on, because I've seen what happens when people come back to themselves like that. And if you're listening, let us know in the comments, and please like the video. We hope you'll try this for just 14 days.